So if somebody came to me from the future 20 years ago, if somebody came from now and met me and said, Doug Brown, 20 years from now, you are going to be a homeopath. You're going to be dedicating your life to homeopathy. I would tell them, you're crazy. Homeopathy was not even on my horizon. I never even thought about homeopathy. I was working as a nurse practitioner. I was trained at Yale. I was doing regular medicine in outpatient clinics, and I was mostly enjoying it. I loved medicine, loved working with people, and I wasn't initially looking for anything different. I had never really even heard of homeopathy. My impression of it was that it was these little white pills that grandmothers gave to children when their noses ran, but that if anything serious were to be needed, regular medicine was what was needed. But over the years, as I did more and more work in medicine and saw more and more patients, I saw that with chronic illnesses, most of my patients weren't really getting better. I was giving them more and more medication. They were getting more and more side effects. They were paying lots and lots of money for these medications. And I began feeling more and more that I wasn't getting to the bottom of patients' problems. I was ordering lots of tests. I was giving more and more of the same kinds of medications, anti-inflammatory drugs, antacids for their stomachs because of the problems the anti-inflammatories were causing. Then I was adding antidepressants because everybody was depressed. But this started to feel less and less satisfying. So I started searching for other ways of understanding what health and illness was all about. I began going to seminars on mind-body medicine. I began reading books about Chinese medicine. I began studying hypnosis. But I wasn't really finding something that seemed very applicable in a busy clinical setting. And then one day my son Russell, who was 2 years old at the time, got very sick with an ear infection. And he had a high fever, and he was crying inconsolably. He wasn't taking enough fluids. So I did what I had learned to do at Yale, and I put him on antibiotics. I gave him amoxicillin. But he didn't really get better. In fact, he seemed to be getting worse. And I was really scared and really worried for him. So I gave him a different antibiotic. I gave him trimethoprim sulfa, which is the standard practice. And he got even sicker. He seemed to become more lethargic. He developed a bit of a rash. So in regular medicine, the next thing to do would be to have an otolaryngologist, an ear, nose, throat specialist, pierce the eardrum to let the pressure out. And I had read studies that sometimes that causes scarring and some hearing loss, so I was a little reticent to do that, reluctant to do that. And somebody told me I should bring him to a homeopath. I said, homeopathy, that's for little problems. This is a big problem. I really had no faith that homeopathy had anything to offer to my son. But since I was desperate and my friend pressured me, I said, okay, I'll bring him to the homeopath. And I must say my experience with the homeopath did not increase my confidence. He asked me questions about my son that seemed completely irrelevant to the fact that his eardrum was red and bulging and he was in a lot of pain. He asked me about what my son liked to eat and what color the earwax was, things that seemed to be completely irrelevant. And then when the homeopath said, let's give your son belladonna, a deadly nightshade plant, that did not make me very happy either. But I was desperate, so I gave my son the remedy, and to my incredible surprise, he got better within hours. And what really amazed me was that by 2 or 3 days after, when I looked at his eardrum had gone back to normal. And I had treated hundreds, maybe thousands of children with ear infections with antibiotics. And even though they often felt better after a few days, after 2 weeks when I looked at their ears, there was usually still fluid behind the ears. But Russell didn't have that. He seemed to just get better almost miraculously right away. So this created in me a lot of cognitive dissonance. I couldn't understand how these tiny little sugar pellets, which had almost nothing in them except something so toxic as belladonna, could cure my son so quickly. So I put it aside. I thought this must have just been a random chance, that maybe he would have gotten better anyway. And then a few months later, he got sick again. I guess the universe wanted to give me a kick in the pants, wanted to open my eyes. So I was traveling with my son. I was in a distant city, but I called the same homeopath, and he asked some similar questions. And he said, once again, give my son belladonna. So I found some of the remedy in the other city. I gave it to him, and immediately, again, he was relieved. So at this point, I said, okay, there's something here the universe wants me to look into. So I began reading some books. And again, what I read didn't seem to make much sense. This idea of treating a problem with something that can cause a similar disease, it seemed so completely counterintuitive. A big part of my rational mind, I didn't want to accept this. Or this idea of treating with infinitesimal doses, something so small it could barely be measured, or maybe it wasn't even present anymore. It seems crazy. It seemed crazy to me. But I had this experience, so I felt obligated to try to understand what happened. So then I started to see if I could replicate this. I would buy some remedies and I would bring them with me to the clinic where I worked. And I studied enough to maybe have some very basic ideas of which remedies to give patients. And occasionally, if my patients were willing, I would give a remedy instead of the antibiotic or the other drug that would be conventionally prescribed. And I didn't know very much, but once in a while it seemed again to produce a miracle, something really quick, rapid recovery, which was not otherwise expected. So my interest grew and grew, and I studied more and more. And then I met somebody who told me, you should meet a psychiatrist who prescribes homeopathy for his mentally ill patients. Now that really got my interest because I had become more and more interested in mental illness and psychological suffering, because that's what most of my patients seem to be suffering from. So I talked to the psychiatrist and he said, you can't tell my colleagues, because if you do, I might lose my medical license. But I can treat very serious mental illness, psychosis, schizophrenia, with homeopathy, and sometimes I get really beautiful results. So now my interest was unstoppable. Really, I couldn't believe this. I really wanted to see for myself. So he recommended I look into a homeopathic school. And he recommended the Hahnemann College in California, where Roger Morrison and Jonathan Shore and Nancy Herrick taught. These were some of the best homeopaths in North America. So I went to visit for one session over a 4-day weekend. And their method of teaching was through videotapes. We would see a videotape of a patient before the remedy, and then we would see a videotape of the patient after the remedy. And I saw patients with very deep illnesses, very severe, intractable symptoms that had been to many, many doctors and had tried all kinds of treatments. And then after the remedy, not only did their symptoms get better, but something very deep inside of them changed. So my eyes were open to healing beyond the kind of medicine that I was familiar with. And I became more and more interested in how to become part of that, how to become part of a healing process, which was more than just controlling or suppressing symptoms, but healing what was behind the symptoms, getting to the core of the problem. Because this is what I had been feeling intuitively was missing in my medical practice. I was trained to come up with medical diagnoses which included a collection of symptoms, but it didn't really get to what was behind the symptoms, why people were developing illnesses. and I was really hungry for, although I wouldn't have been able to say it in those terms at the time, but I was hungry for a model of illness, a model of wellness that saw illness as the physical expression of a suffering that went beyond the physical, that also included the mental, the emotional, and dare I say it, the soul. What is the suffering of the soul? And homeopathy allowed me to satisfy that thirst, to come up with, to understand people's suffering and physical illnesses in a way that went deep, and not just labeling collection of symptoms with the name of a medical diagnosis. Do you have a question for me?
Do you recollect some nice cases or some stunning success in your practice?
There are many, many successes, and one of the wonderful things about homeopathy is that you actually stop being surprised sometimes when people recover from illnesses that as a conventional healer you would be very surprised. I have many cases where people have been suffering for years, for example, with chronic pain. Usually they have a diagnosis of fibromyalgia or some kind of rheumatoid arthritis, some kind of autoimmune disorder like polymyalgia rheumatica, many cases like this with lots of pain. And after homeopathy, the pain goes away and they're able to stop taking all of the medication they were on. Usually people have been on antidepressants and nonsteroidal anti-inflammatory medications. Sometimes I've had patients come to me who have been on steroids, prednisone, for many years with all of the side effects of those, who are able to stop the steroids. I have had people who have been very confused in their life and suffering from even psychotic type of symptoms, who have been on heavy doses of psychotropic medications and who lose touch with themselves. And after a remedy, they're able to get off the medications and feel much more in touch with who they are and feel happy without the medications. I have a few cases of cancer which have recovered. I had one case of a friend actually who was diagnosed with a high-grade glioblastoma and was not expected to live for more than a few months. And with a remedy, he lived for 7 or 8 more years before he died peacefully. So yes, many, many cases.
Thank you very much.
You're welcome. My pleasure.